you can do to keep yourself safe is Dr. Awai Durrani. He's an emergency medicine physician. Thank you so much for joining us, doctor.
Yeah, thanks for having me.
Measles cases are impacting dozens of states across the U.S. Why are we still seeing the spread of this virus right now?
Yeah, so there's a few reasons for it. Measles is one of the most contagious pathogens known to mankind, essentially. If someone has measles, they walk into a room and they walk out, measles will be in the air for about 2 hours. So someone walks into that room 2 hours later, they'll still get exposed, and if they're unvaccinated, they'll get infected. So that's one reason. It's really pathogenic. It's easy to spread. The other is we used to have herd immunity. We actually eliminated measles in the United States in the year 2000, but that's obviously not the case anymore. And so you need 95% vaccination rates for herd immunity. We are below that threshold in many communities, especially the ones where we're having these outbreaks. And then even where the outbreaks aren't happening, those numbers are still not up to that 95% number. And so when people get exposed, they unfortunately get infected. And then obviously you add in travel and congregation and all of that, and you get a whole bunch of infections.
What about Americans who are watching right now and say, I got vaccinated when I was a kid, when I was a baby? Do I need to worry about this? What would you say to them?
Yeah, so that's amazing news. It's a vaccine that is probably one of the best vaccines we have, and you only need to be vaccinated through that 2-dose schedule as a kid. And if you got vaccinated as a kid, you're good. You don't need to get a booster. You don't need to get revaccinated. There's very, very small exceptions for certain populations, but for the majority of the country, if you got vaccinated, you're good.
What do you make of the vaccine hesitancy in this country? What do you think is fueling that?
Yeah, so it's a combination of issues. Obviously, it starts with online misinformation. That's something that we've seen a lot over the last decade or so. Lots of folks putting out information that is not easy to rebuttal. And we already know that the stats on misinformation online, if you post a fact versus misinformation, it spreads almost 6 times quicker on various platforms. So that's part of it. And then leadership is a part of it as well. We need strong leadership that puts out guidance. I'm encouraged that we got this guidance from the CDC to get people aware of measles, and if they're traveling, to make sure that they are vaccinated. But we need more leadership like that to promote vaccination and fact-based science. And unfortunately, we haven't had that recently. And because of that, there's a lot of misinformation. Patients may get confused, and unfortunately, those vaccination rates can drop.
What do you make so far of the leadership from Health and Human Services Secretary RFK Jr. and his response? Have you been satisfied?
I have not, to be honest. I'm obviously based in Texas, and we were one of the first states with that big outbreak in Harris County. We've had numerous cases here. And, there's one true proven thing that we have that can prevent these infections and prevent the unfortunate deaths that we have as well, and that's vaccination. And he's, mentioned vaccines at times, but then he's also mentioned other things that are not proven and not based in science. He mentioned vitamin A, and unfortunately, some patients, some parents gave that to their kids, and they overdosed on vitamin A, and they got liver failure from that, and they were hospitalized for that. And so, I hope he does better, because lives are at stake, and we all need to be healthy.
Yeah, and I think the World Health Organization, you can correct me if I'm wrong, but they recommend vitamin A as a treatment, not as prevention. Is that right?
Exactly, yeah. And in certain countries, there is malnutrition. And so when kids get measles, they may be low in vitamin A to begin with, and then they're more susceptible to having a worse case of the measles and getting pneumonia and things like that. In the United States, thankfully, we have good nutrition. 99.9% of folks are good on their vitamin A. They need to get vaccinated to prevent an infection.
All right, Dr. Durrani, emergency medicine physician, thank you for joining us today.
Thanks for having me.
36 minutes.